Well, one more year. Here we are. Good morning, one and all. I'd like to acknowledge the Per Amor a l'Arte Foundation for allowing us to use this venue, the Valencia Research Foundation for being supporting us every single day. I'd like to also thank the speakers because they will be addressing the condition, the pharma industry. We're in here and out there because you help every day. And I'd also like to say a big shout out to sponsors and Wilson disease patients and families in Espinós. Thank you. We're here thanks to you. Without further ado, I'd like to give the floor over to Luis, and we'll go into all the nooks and crannies as the day evolves. Thank you. Good morning, everybody, and welcome. For those of you who've been here before, and for newcomers, very briefly, because last time I spoke for too long and I killed the agenda. I'm Luis Soler. I am the son of Susana Lloret, and I'm a patient of Wilson's disease. I was very lucky because I was diagnosed very early at the age of 5, and my condition was tricky at first. I had quite a bit of a liver involvement, but thanks to an early diagnosis, I started on medication very fast. I'm okay today. I'm 22 and I'm perfectly healthy. Notwithstanding this, I had to undergone difficult moments, times of uncertainty and doubt. And I'm pretty sure that relatives, patients, and physicians in the room know what I'm talking about. So it was a roller coaster of sorts. It can be complicated, but I am endlessly grateful to the healthcare professionals and my mom, because here I am thanks to them. I am no doctor. I am an engineer. And I can contribute or try to contribute with my little bit to clarify uncertainties around Wilson's disease. Again, I'm an engineer and I'm a young adult with Wilson's, but I've been a college student with Wilson's, a teenager with Wilson's, a child with Wilson's, so I can say that many of the doubts that you may have, I have had too. I've undergone challenging times as you, and I would like to help you through that. So to all the youth or relatives who have questions about Wilson's at early age, I encourage you to talk to me at any time and say, hey, Luis, I want to talk to you, and I'm going to be around. I'm sure that I might be able to help sometimes. Just by talking, things become more manageable. And you need to realize that here we have patients, relatives, researchers, physicians, pharma reps, all the stakeholders, and we're all among equals, and it is a great opportunity insofar as you can talk to doctors, researchers, physicians can speak amongst themselves, relatives amongst themselves, and it's a fantastic opportunity to see how others are doing in this struggle, and learn and teach and share and help others and be helped. So in a nutshell, it is fantastic to be here together in this relaxed environment without having to wait in line for the doctor to see you. So just talk, enjoy the day, and make the most of it. Thank you. Good morning, one and all, and welcome, especially those of you coming from abroad. Also, I'd like to welcome those who are locals. I'd like to begin with acknowledgments, because putting this event together has involved hard work of many for months. So I'd like to thank the Patient Association members for helping to put this together. Faustino, he is able to be in several places at the same time. Inexplicable, if you ask me. Aida, if half the people in this country worked as hard as she does, the productivity of Spain will be across the roof. Wow, what hard effort, what a willpower to persevere, to advance. It's wonderful, wonderful. We're here thanks to them. A big shout out to Per Amor al Arte Foundation. Susana, Luis, thank you for allowing us to enjoy this venue and always, year after year, be there for us. I would also like to express my gratefulness to speakers, both local and from farther afield, because they have very busy agendas, and this year it's been especially tricky, and they're still here, and it's been challenging. So thank you so much for being here. A few hours, a few days. We're really, really grateful. Thank you all. If I may, I would like to simply say that we have experts in certain clinical areas who are nationals. I hope I don't forget anybody. If I do, my apologies. We have Peña, who's a pediatrician from Las Pedras de Gran Canaria, Mr. Molina from Plantel Postcostela, Nadelia Urdiar, who's a neurologist, experts. They have numerous Wilson disease patients. It's a great opportunity to ask them any idea, any question. Today is the day to pitch your questions. We have Marce Casanovas, a physiotherapist. Let me check who else. We have an expert from London, Rapta, who will be specifically discussing skin conditions. And after lunch, we will focus on something that is a bit more tedious to explain, but we have Ariana, and I don't know if you remember, Hans talked about the GI barrier. We have also therapy, gene therapy for Wilson with Pasquale, and we'll have a roundtable, a colloquium of sorts, with Marina Berenguer, as Gloria Gonzalez, Luis Garcia Villarreal. So there are people in here who work on Wilson. We might come on stage, even if whether we do, whether we don't, we're here. Come to us, and we'll help if we can. I don't want to take up more time, but this gentleman over here has a bell. Can you show everybody your bell? So, speakers, be warned. You have been allocated the time you've been allocated. Don't speak too long, or else you're going to be belled away from stage. You have not rang that bell. Have I spoken too long? Did I take too long? We didn't catch the reply because anyway, thank you all very much, and thank you for being here. Thank you for making this possible. We are extremely grateful. I am personally very, very grateful. Welcome, one and all. I failed to mention that we would appreciate you setting your phones on silent mode so that we can all focus on the topic at hand. Thank you. All right, let us now begin with our first talk by Esther Molina from the Santiago University Clinical Hospital. She will be discussing an update of clinical practice guidelines for Wilson disease.